Our topic this week is when and how will the COVID-19 vaccine be distributed in Oregon? And is it safe? Today, I am speaking with Clackamas County's Public Health Officer, Dr. Sarah Present, on this issue. Welcome, Dr. Present.
Hi, Kimberly. Thank you so much for having me here today.
How soon can we actually see the COVID-19 vaccine in Oregon?
Well, it appears we will likely get the first doses of vaccine in Oregon within a week, which is very exciting. And it really helps shed some light and hope on this rainy day when so many Oregonians are sick from COVID-19. This will not be enough to vaccinate everyone who needs it, but it is a start.
Some people are worried that the vaccine may not be safe because of how quickly it was developed. Is it safe?
Absolutely, yes. I want to assure you and everyone in the community that the speed of the COVID vaccine testing did not compromise safety or the scientific integrity of the process. There's not been any change in the evaluation of safety of this vaccine compared to other vaccine development. What is primarily different is that we don't have as much information about its long-term effectiveness, although even that data looks really very promising. I'm confident in the safety of the vaccines. They've been tested on tens of thousands of people and shown to be highly safe and highly effective for at least 3 months and almost certainly more. This effectiveness will have a huge impact on the pandemic and letting us get back to a normal life. And it's important to note that a coronavirus vaccine won't work if people don't take it.
How will we vaccinate the entire community?
Great question. We estimate that we need to get at least 70% of our population vaccinated to have what we call herd immunity. That's going to be a lot of vaccine, and it's going to come in phases over a number of months. We will vaccinate first what is called Group 1A, which includes healthcare personnel and residents in long-term care facilities. There will then be vaccine rolled out to other populations, and we're really looking at end of spring, summer, perhaps even into the fall before we can get vaccine to everyone who needs it.
You mentioned long-term care residents. Why long-term care residents, and will we have enough vaccine?
Yeah, long-term care facility residents make up more than 38% of all COVID-19 deaths, but only 5% of the total number of COVID-19 cases. They really are the ones who are at highest risk of severe complications and death from this disease. So helping them first will save lives. And no, we won't have enough of vaccine at the very beginning. People have to understand this is a massive rollout and it will take time, but we will do it methodically and with patience, we will get through the end of this pandemic.
So how will the county ensure that historically underserved and marginalized communities will have equal access to the vaccine?
We've made an equity a focus since the onslaught of the pandemic, knowing that the long-term health effects of disparities and the disproportionate effects of this disease are felt by Black, Indigenous, and people of color communities. The county formed an Office of Equity, Diversity, and Inclusion this year to ensure that our county policies eliminate structures of oppression and unbalanced power. Emergency Operations Center has formed a group of nearly a dozen people to engage with this historically underserved and marginalized populations to ensure that they receive the support that they need to survive this pandemic.
And that's the approach that the county took for the flu vaccine this year as well, and our COVID-19 testing, is that right?
Exactly. We partnered with 19 different community-based organizations who have built trust and have strong relationships within their communities. We help them hold flu vaccinations and COVID-19 testing in communities and work sites such as farms. We will help them stage accessible vaccine events as well when the time is right and when it's available. We've worked hard to provide members of the Black, Indigenous, and people of color populations, often termed BIPOC, and other underserved individuals with adequate PPE, testing, food, housing, flu vaccine, and funding to support their businesses during this pandemic.
In the meantime, we need to keep our guard up, don't we?
We really do. Oregon and Clackamas County are facing the worst of this pandemic right now. We have unprecedented numbers of cases throughout the county. Our hospitals are strained, and sadly, more Oregonians are dying per day from this than ever before. So please, I ask everyone to keep up your guard. Wear your facial coverings, keep your distancing, Stay home if you're sick or known to be exposed. Limit your contacts outside your home, and please stay safe.
Well, thank you, Dr. Present, and thank you for joining us. Please stay safe, and we'll see you next week.